So I'm glad to be here. I'm glad you guys are all here too. So let's pull up those slides.
Thank you.
So I just wanted to start with, whoa, where'd you go? Okay. You can go to the next slide. Let me see if I can pull this down so I can read it. So the National Cancer Institute defines cancer-related fatigue as a distressing, persistent sense of physical, emotional, and/or cognitive exhaustion related to cancer that is not proportional to the activity. It does not necessarily improve with rest or sleep and interferes with functioning. And it's estimated that about 80% of patients experience fatigue during active treatment, and about 20 to 30% of patients have it lasting for months or years after treatment has ended. I personally remember during chemotherapy at one point telling my husband that I was just too tired to watch TV, that it just took too much cognitive exertion to even follow a TV. So there's that type of cognitive as well as the physical exhaustion. Next slide. Some of the symptoms can include generalized weakness or limb heaviness. Just feel like your arms, your legs are heavy. Like I said, diminished concentration. You don't feel refreshed when you get up from sleep. You have difficulty completing daily tasks due to this fatigue. You have decreased motivation to engage in some of the usual activities, and the fatigue seems to last several hours or longer. And, taking a nap does not seem to help. Next slide. So the National Comprehensive Cancer Network, or NCCN, puts out guidelines for treatment. This is what an oncologist follows when they're deciding on a treatment plan. They also have some out for what are called supportive care. And this is the one they have out for fatigue, but I'm not going to, this one makes it too hard to go through it. I just wanted to show you that. Go to the next slide. So some of the treatment that's out there for this fatigue, one of the strongest areas of research and strong support is exercise. And it really sounds counterintuitive when you say, I just told you I'm too tired to do this, and now you're telling me to go exercise. But evidence shows that any aerobic or resistant training in these interventions can significantly help with this fatigue. And, I tell patients just going for a walk, even from the very beginning of treatment, light stretching yoga, swimming, anything like that is going to help the fatigue, even though it sounds counterintuitive. The other thing is the psychoeducation, this cognitive behavioral therapy. How do we think? How do we react to things? This can help a lot with just the coping strategies of how to manage fatigue and its impact on your life. There's a lot of mind body therapies, so this mindfulness based. Tai Chi and Qigong are very movement based. We have some folks on the platform that can teach this. And in terms of, is there a medication you can take? So if you go to a palliative medicine physician, go back, oh, stay there. If you go to a palliative medicine physician, they may put you on what's called a stimulant, like Ritalin or something like that. There is one supplement that has research to show that it's effective for cancer-related fatigue. So if you put all these together, it's the exercise, it's this cognitive behavioral therapy, these mindfulness programs, and these yoga, acupuncture, even acupuncture can help with a lot of fatigue. Go to the next slide. So go ahead. So this is American ginseng. The research was a large trial looking at cancer-related fatigue, and it showed significant benefit in reducing that fatigue. And actually, it's in some of the current oncology guidelines that you can recommend this for fatigue in patients. And so the patients always ask, well, what type or what do I buy? Next slide. Consumer Labs is an organization that studies the quality of supplements, and these are the two brands that they recommend. This Imperial Elixir American Ginseng or this Prince of Peace ginseng powder, and you take it based on instructions. I actually had a patient 6 weeks ago. She's a colorectal cancer patient, has cancer, still under treatment, has cancer in her liver, put her on this, and she came back and said it made a remarkable difference in how she feels. So that's all for the slides. And so I'll also say that when I see a patient in my clinic who complains of fatigue, there's several things that I want to look at. I want to look at where are they in cancer treatment? If are you in chemotherapy? Are you in radiation? Are you just taking oral medications? I always want to make sure are you anemic? Did anybody look at your labs since you finished treatment? Do we need to check an iron level? You know, how about B12? How about just some basic labs to rule out something that could be corrected? If someone is having chronic pain and they're on a pain medication, that can certainly contribute to fatigue. How are you sleeping? How's your nutrition? What stressors are going on in your life? So it's always, to me, fatigue is always like an onion. So I have to go through all these layers to find out what could be the cause and what could be treated. So that's a very heavy medical introduction to fatigue. I'd like to open it up to you guys to hear what questions you have, experience you've had, or what has helped you.